Health Department staff don't know when they'll have enough H1N1 vaccines to supply the general public. Staff say supplies of the shot are trickling in, but you may be surprised at who will be able to get an H1N1 vaccination now. SNN Local News 6 reporter Jessica Jordan is live at the Health Department with more on this. Jessica.
Well, Lauren, jail inmates may be among the first groups of people to get the H1N1 vaccine, even as Health Department staff here say they don't even have enough shots to go cover all of the students in Sarasota County. It could be weeks before the general public is able to get the H1N1 vaccine. Right now, it's being rationed out to people who fall under the high-risk category. That includes pregnant women, healthcare personnel, and people under 24 years old. And now, some jail inmates who fall under those high-risk categories may get their H1N1 shots early, too. That means some inmates may get their shot before some children. That's not sitting well with some people, especially when the first local H1N1 clinics for pre-K and kindergarten school children won't begin until Thursday.
My concern is that they're not going to get all the children taken care of before they're starting to think about inmates and other people. The priority should be the children first.
I think the general public probably deserves it first.
The CDC says the high priority guidance applies to all high-risk people, whether they're in prison, a homeless shelter, a school, or nursing home. Places with large groups of people can act as breeding grounds for viruses. That's why some of the people we spoke with say vaccinating inmates should be a priority.
If they have the flu get spread in jail, you have a bigger problem with having to pay for it than the general public. And, if it gets out of control, it could be a major problem.
All these inmates have family, relatives, children that are coming in visiting. What's going to happen unless they stop the visitors from coming in?
A health department nurse is working with the sheriff's office to determine how many more inoculations the jail will need.
This nurse is doing assessments of the inmates to determine which inmates are in those priority groups that have been established by the CDC.
For now, the health department is dispersing the limited H1N1 vaccine as they get it, one priority group at a time. They've not received enough vaccine to provide clinics to older children or young adults yet. Staff say they're following regulations set out by the Center for Disease Control.
So what makes a priority group is what CDC has looked at across the United States as to who is getting sick, who gets complications, and who dies from the illness.
People who work with the inmates will also have priority at getting the vaccine because they fall under the category of healthcare providers.
Jessica, I know these clinics are coming up for local children. Let's talk a little bit about those for a moment. If you're a parent and you're planning to take your child to one of these clinics, what do you need to bring with you?
Well, health department staff say you can come by here and get a consent form. Make sure you have that and your ID. And they are also stressing that these clinics are only open to pre-K and kindergarten students. Lauren?
All right, Jessica Jordan reporting for us at the Health Department. Thanks, Jessica.